Hi, today I'm going to be talking about the ethical dilemma of undertreated pain related to the opioid crisis going on in today's world. In the past 10 years, according to Brennan, there have been 200,000 deaths related to opioid prescription overdoses, and this death toll continues to rise every day. Being in this epidemic we are in, it is starting to affect the care that physicians give to treat pain in patients. Um, Being a nurse on an acute care floor, I have witnessed patients being undertreated for pain, and when asking the doctor if we can get something a little stronger, more times than not, the doctor will say no. They're going to have to just deal with the Tylenol or the Ultram, and that's all we can really do for them. We can do some environmental changes, but other than that, medically, that's all we can prescribe them. I found this very odd, and then as I continued to grow as a nurse, I noticed that um, doctors have been changing the way they practice medicine. Some doctors are more apt to prescribe opiates, and others refuse completely. So, this being said, I do stand by the support of prescribing opiates to patients to adequately manage pain. There has been a lot of new policies brought up. Nathan Gervimont has brought up many points in his article about the guidelines, the federal guidelines, the state guidelines, all of which impact the way a physician can prescribe opiates. Um, and as this epidemic continues to go on, the guidelines become more and more strict and leaves the physician with not many options for managing the pain. They do use something now called Prescription Monitor Program Database. This allows the patient to, or excuse me, the physician to look at the patient's history of past prescriptions, um, helping them see if there's a trend in their behavior or medication request, or just to see if they can prescribe the opiates without having to worry that they have another prescription coming in also. So not only does this help the physician protect their license, but it also helps manage the drug-seeking patients. It helps us to see, the physicians to see whether or not this patient has a history of coming to the hospital and asking for pain meds. Unfortunately, the opioid crisis has put on all healthcare radars of possible drug seekers. We look out for certain signs of um, patients asking for pain medicine, and there is a stigma, unfortunately. This also can tend to lead to undertreated pain.